Stay tuned and enjoy this podcast.
Hello, friends. Welcome to Treatment Possible. And today we have Dr. Dhananjay Malankar with us, who is a senior consultant pediatric cardiac surgeon in Fortis Hospital, Mulund, Mumbai. He is amongst the leading pediatric cardiac surgeon in this region of Western India, and he does highest number of cardiac surgeries. So, Dr. Dhananjay, welcome to our show, and thank you for taking out time for our listeners.
Yeah. Cyanosis means abnormal bluish discoloration of the skin and mucous membranes. So there are certain lesions which lead to cyanosis of the skin, like tetralogy of Fallot and transposition. Whereas there are other lesions like a plain simple VSD, ASD, and AV canal, which do not lead to cyanosis, but they lead to other symptoms like breathlessness, recurrent respiratory tract infections. So they are clubbed under acyanotic congenital heart defects.
It means when the blue syndrome, when the baby
the
turns
blue baby
blue.
syndrome. Yeah, when the skin is when you see that the baby has abnormally blue skin, okay, and a mucous membrane like tip of the tongue and then lips, all these they become blue, especially more when the babies cry. Those are classified as cyanotic congenital heart defects.
Got it. So that's a visible symptom, but in case of cyanotic, the symptoms are not immediately visible.
Yeah. So acyanotic are further classified into two types. First is the left to right shunt lesions, meaning the blood from the left-sided chambers flows into the right-sided chambers, because the pressures on the left side is always higher than the pressures on the right-sided chambers. So whenever there is a defect like a atrial septal defect or a ventricular septal defect, then more blood flows from the left side of the heart to the right side of the heart into the lungs.
Okay.
So these are called as left to right shunt lesions. So classical among them is the VSD or a ventricular septal defect, and the other one is the atrial septal defect, and then two more. These include patent ductus arteriosus or a PDA and AV canal defect. So these are the four left to right shunt lesions. Okay. So basic symptoms in these left to right shunt lesions is breathlessness, because more blood goes into the lungs. There is congestion of the lungs, and that leads to recurrent chest infection, recurrent pneumonias, recurrent respiratory tract infections, and the baby has to breathe very fast. So because of that, most of the energy is spent in breathing work, and that's why the babies don't gain much weight. So there is inadequate weight gain.
Okay.
So classically you will see these babies, they are malnourished, they are cachectic because they are not able to gain weight, and because of recurrent chest infection they have recurrent hospitalization for pneumonias.
Okay.
These are classical left to right shunt lesions. Okay. In these babies you won't find cyanosis. They are never blue because the blood supply to the lungs is more.
So there is more oxygen in the body.
Yeah, so more oxygenated blood is going back to the lungs through the septal defect.
Got it.